Hey everyone, in this video we're going to discuss the substrates, inducers, and inhibitors of CYP1A2. For some background, CYP1A2 is an enzyme in the liver that's part of the CYP450 system. It's involved in the metabolism of many drugs, including important psychiatric drugs such as Clozapine and Olanzapine. One of the main concepts I want to explore in this video is that certain factors can act as either inducers or inhibitors of 1A2. And so what I really want you to remember is that factors that induce 1A2 will accelerate substrate metabolism. So this means that 1A2 is acting on these substrates and metabolizing them. So if you induce 1A2, it's going to accelerate substrate metabolism. On the other hand, we can say that inhibiting 1A2 leads to slower substrate metabolism. We'll talk briefly about the substrates of CYP1A2, and these are drugs that are metabolized by 1A2 like I just mentioned. And all of the information that I've gotten is from Indiana University's Flockhart table, which is a really good resource that I recommend you take a look at. And they've kind of split up these different substrates based on the degree of evidence. And so you could see strong, moderate, and weak. And I've highlighted the ones that are more relevant from a psychiatric context. And so the ones that stick out are Clozapine, duloxetine, fluvoxamine, haloperidol, olanzapine, clomipramine, and imipramine. Now we'll talk about the inducers of CYP1A2. And so what inducers do is increase the amount of CYP1A2. This leads to an increased rate of metabolism of that substrate, which will lead to decreased plasma levels of that substrate or of that drug. And then this leads to a decreased effect of that drug. So important inducers to be aware of, especially are carbamazepine and tobacco. And so to give you an example to wrap your head around this, you can consider a patient taking clozapine, which, as we mentioned before, is a substrate of 1A2. So this is a drug that 1A2 is metabolizing. So a patient is taking clozapine who also smokes tobacco. And we just said on this slide that tobacco is a 1A2 inducer. So it will actually increase the metabolism of our substrate, which is clozapine. So we get increased clozapine metabolism, which leads to reduced plasma levels of clozapine. And so we are getting a decreased therapeutic effect. We can contrast this with inhibitors of CYP1A2, and so inhibitors compete with other drugs for a specific enzyme, so the substrate can't be properly metabolized. And so some of the drugs that kind of stick out here include fluvoxamine, propranolol, and oral contraceptives. An example here would be a patient taking clozapine, which we just said is a substrate of 1A2, who's also taking fluvoxamine. So fluvoxamine, brand name Luvox, this is a 1A2 inhibitor. And so what happens is the patient taking these medications will have decreased metabolism of clozapine. So they'll have elevated levels of that clozapine, and as a result, they can experience dose-related side effects. And that includes everything from ileus and constipation to agranulocytosis and myocarditis. So here's what I really want you to consider when thinking about CYP1A2. So a patient taking a CYP1A2 inducer, such as tobacco, and also taking medications such as Clozapine or Olanzapine, right? So we have our 1A2 inducer. That is going to cause faster metabolism of our antipsychotic, which will lead to decreased levels of that antipsychotic. So in a clinical setting, what might need to happen is for a physician to actually prescribe a higher dose of the antipsychotic for that patient. On the other hand, if a patient is taking a 1A2 inhibitor such as fluvoxamine and also taking clozapine or olanzapine, the fluvoxamine is acting as a 1A2 inhibitor. So this is causing slower metabolism of their antipsychotic. And as a result, you'll get increased levels of the antipsychotic, and the patient will be at a higher risk of toxicity. So clinically, a patient may be required to lower the dose of their antipsychotic to ensure that they're not at risk of those very serious side effects. Once again, I'd really like to recommend the Flockhart table. It's a great resource to consider when thinking about medications. Thank you guys for watching. If you have any questions, please feel free to leave them below.